another video so that I could go over the question that I received. And this question is from Module 1 specifically, and it says, why is blood sugar in target necessary to slow loss of kidney function? Do all kidney failure patients have a form of diabetes? So I want to start from the second question there. Do all kidney failure patients have a form of diabetes? And the answer is no. Only about 38% of our kidney failure patients have diabetes. Diabetes is the number one cause of kidney failure. Diabetes type 2 is the number one cause of kidney failure, but it only accounts for like about 38% of the patients that you will see at the clinic with kidney failure. So the other reasons could be, high blood pressure, glomerular diseases, lupus, different things. So going back to why is keeping the blood sugar in target so necessary to slow the process of kidney failure. This part also refers to the patients that have kidney failure, but they also have issues with high blood sugar. Okay, so this is specifically for them. And the reason is this. Let's kind of try to make sense of all this, because I know that if you understand this well, you will be able to explain this to others, and you will be able to take better care of your patients and all that. Okay, so going to the kidney cell. So this is the kidney cell or nephron, okay? So the kidney cell is called nephron, the nephron, okay? So you know that all of our cells have a nucleus. So the kidney cell's nucleus would be the glomerulus. So this here would be the glomerulus, okay? And this would be the tubules, okay? Now, remember, as discussed in the class, is that the glomerulus has this outer portion of it is called the Bowman's capsule. So it's the Bowman's capsule. And Bowman was the person that discovered it, okay? So the glomerulus is the Bowman's capsule, which is that capsule in the outside, and then in the inside, it has a bunch of capillaries, okay? So vessels. So let's say these are the vessels. I should have chosen another color for the Bowman's capsule. Hold on. Let me see if I can. Yeah, I think this is better, so that you can differentiate it, okay? So small, tiny capillaries come into the cell. So imagine this cell, you cannot see this cell in plain sight. You have to see this cell under a microscope. So imagine how small these capillaries have to be able to fit in here, okay? So the capillaries come into this Bowman's capsule. They form the glomerulus. And from here is where the extraction of fluid and the filtration of our blood happens. It's at a small level, okay? But we have millions and millions and millions of nephrons. Now, going back, because if you let me, I would be here all day talking about this, but let me focus and go back to why is it important to keep the blood sugar in check. So when the blood sugar spikes in blood, okay, normally what happens is if the person has their body and their system functioning correctly, insulin will be secreted, and then insulin will capture the sugar and the sugar cells and will bring them and push them into our other cells, okay? But now, when a person has diabetes, these functions are not working correctly. So it's either that there's not enough insulin to catch all of the sugar, or when the insulin brings the sugar to the cell does not accept that sugar and it repels it, keeping that sugar in the bloodstream. So that is very dangerous. When the sugar is in the bloodstream, is very dangerous, specifically also if it's at a high level. So when that happens, that sugar cells are like in a crystal form, are crystallized. And when that happens, and there's a lot of them, they start accumulating inside of these vessels, creating a clog. Can you see this? Creating a clog. So they create a clog. Hopefully you can see how it's clogged right there. Yeah. Okay. So what happens is that now no circulation can come in here. No blood circulation can come into this particular cell. And if that is clogged long enough, the cell starts to die. Okay? So when the cell dies, we lost that nephron. We lost that nephron. So if this is happening, remember that it's not happening just in one cell. It happens in a lot of those cells. So the faster we lose nephrons, the faster the progression of kidney failure. Okay? So if we already have kidney failure, or if the patient already has kidney failure, but they are able to keep their blood sugar in check, then we minimize the risk of these vessels clogging and keeping the nephrons that they still have and that are functioning correctly. Okay, hope that makes sense. And if you have further questions, just let me know. Reach out and let me know, and I'll post another video with more discussions. I hope you like this video, and you can reply to this email. Let me know what you think. Do you like this, of me sending you videos like this so that you can all look at it? Another thing I wanted to add before I leave is that this clogging of these tiny capillaries is the same thing that happens when diabetes patients start losing their toes, because the further away the vessel, the blood vessel from the heart, the smaller it is. Okay, so up here in our torso we have bigger vessels. Okay, so they're big. As we go down to down the leg to our feet, into our feet, they become very, very small. They look like roots. Okay, so that is the reason why when a patient that is a diabetic patient and the blood sugar is not under control, when they have spikes of blood sugar, like the blood sugar really high, that sugar, crystallized sugar, it accumulates in those tiny small vessels. That's why they start losing the toes, because then there's no circulation towards those tissues down there. Necrosis starts to happen, the death of the tissues, and then it comes to a point that the doctor has to start cutting out toes because they catch gangrene, and it's just, like, it's a downhill process. But it happens because the tiny vessels clog. Same thing when they lose the sight. You see, it's very common for a diabetic patient to lose their eyesight, to have amputations. And if you think about it and if you analyze it, those areas where they're having these issues, these problems, is where tiny vessels are the ones responsible to nurture those areas. But if those tiny vessels are clogged, unfortunately, they will lose the function in those areas. So it happens also with the kidneys. The tiny capillaries are the ones that are responsible to take nutrition into the cells. If they're clogged, the circulation can't go through, blood can't go through, oxygen can't go through, nutrition cannot go through. Okay, so I hope you understood, and I hope this makes sense. Let me know if it doesn't so that I can add more explanation to this. Okay, see you soon. Bye-bye.